Sometimes things happen in our bodies that seems minor and which may be tempted to dismiss. However, some of these are health warning signs that should be evaluated by your healthcare provider so they can be effectively treated before they turn into more serious problems. Pay attention to these medical symptoms you should never ignore. Number 1. Rapid weight loss. Having extra pounds melt off without even trying sounds like a dieter's dream come true. However, this can be a signal that something is going wrong in your body. If you rapidly lose 10 or more pounds for no apparent reason, no dietary change or new exercise program, your doctor needs to evaluate you. Why? It could be a sign of physical or mental illness such as depression if it is accompanied by feelings of sadness or fatigue. Number 2. High or persistent fever. Most of us get fevers from time to time as our bodies fight infection. However, if you have exceptionally high fever, which is 103 degrees Fahrenheit or more, or a fever that persists for at least 3 days, see your doctor. Fever also can be a symptom of COVID-19, so contact your physician, especially if you have other symptoms like a cough or headache. Night fevers accompanied by night sweats can be an early cancer warning sign, so report these to your doctor too. Number 3. Chest pain. Intense chest pain or a sense of heaviness in the chest can be a sign of heart attack, specifically if accompanied by sudden severe left arm pain. These are classic symptoms for men. Women's heart attack symptoms may be different or subtle. While they may have chest pain, it might be intermittent. Women also are more likely to have back or jaw pain, pain in their right arm or left arm, shortness of breath, nausea and vomiting. Call the health emergency number or an emergency room if you have heart attack symptoms. Number 4. Sudden numbness or weakness. If you suddenly have difficulty moving your legs or arms, especially on the side of your body, you could be having a stroke. Other signs include facial drooping, also on one side of your body, difficulty talking, confusion, trouble seeing out of one or both of your eyes, and dizziness or loss of balance. You may also have a sudden severe headache. These are serious health symptoms that merit immediate emergency care. Number 5. Fatigue. Many of us are busy and stressed and may be exhausted due to everyday life concerns. But if you have borne deep fatigue that seems different from normal tiredness and doesn't get better even when you get enough sleep at night, this is a health warning sign that you need to discuss with your doctor. Fatigue can signal many serious problems including anemia, diabetes, depression, sleep apnea, chronic fatigue syndrome, kidney disease, heart disease, cancer and others. Your doctor can help determine why you are feeling this way and what can be done to help you feel better. Number 6. Skin changes. Your largest organ is your skin and it can reflect the state of your health. If you notice your skin, specifically your fingertips, has a yellow appearance, this can be a sign of jaundice, which can indicate possible liver or gallbladder problems. See your doctor if you have this symptom. Other skin changes you should never ignore include large, rapidly growing, bleeding, or otherwise unusual skin lesions or lumps, as well as suspicious changes to existing moles. Contact your primary care doctor or dermatologist to check out skin symptoms as soon as possible. Number 7. Abdominal pain. See your doctor if you have severe or persistent abdominal pain, which can indicate serious health problems such as appendicitis, intestinal blockage, gallstone, and a host of other conditions. Other warning signs that it means it is time to see the doctor include diarrhea lasting more than 3 days, black, tarry stools, blood in your stool, and heartburn that persists or worsens even after you take medication for it. Number 8. Unusual headaches. Most of us get headaches now and then, which go away either on their own or after taking over-the-counter medication. But some headaches warrant prompt medical attention. If you have a headache along with a high fever, stiff neck, confusion, fatness, or trouble speaking or walking, you need to go to the emergency room. Also, don't ignore headaches that have become more frequent or severe than normal. Don't get better with medication and interfere with work, sleep, or other daily activities. These should be evaluated by your doctor. Number 9. Shortness of breath. If you suddenly find yourself short of breath for no apparent reason, you have not just been exercising, for example, you need immediate medical attention. Acute shortness of breath could be a sign of many conditions, ranging from COVID-19 to asthma, a clot in your lung, collapsed lung, pneumonia, heart dysfunction, or an allergic reaction. Shortness of breath that is more long-lasting can be caused by chronic or other conditions. Either way, difficulty breathing is a medical symptom you should never ignore. contact your doctor or seek emergency care. Last but not the least, number 10, sadness that will not go away. Feeling of depression or sadness, perhaps alternating with the extreme high and signs of mental illness, and should never be ignored. If you are depressed, you likely will not feel like interacting with others and may not feel enough energy to call a doctor. However, it's important to get help. See if a loved one can connect with a health professional for you. Other warning signs to report to a doctor: changes in eating or sleeping habits, thoughts of hurting yourself or others, delusion or hallucination, or having excess anxiety. Seek help promptly if you have any of these. If you found this video informative, make sure you like this video and share with your friends, because in the matter of health, sharing is caring. You never know who's experiencing one of these symptoms, and it is always better to find out about these symptoms as early as possible. Please subscribe our channel and don't forget to write "I subscribe" in the comments below, and I will reply you as soon as possible. See you in the next video. Stay healthy and safe.